We're going to start with the upper extremity with the shoulder, and then we'll do a separate video for the elbow and another video for the forearm and the hand. So looking at the shoulder, there's a lot to it, a lot of detail, very, very fine detail. Towards the end of this PowerPoint, you should be able to start to point out stuff, but make sure you study it before you come to class. So coming across, we'll start with the acromial end of the clavicle. We have the scapular notch with the body of the clavicle, and then we have the sternal end of the clavicle. So you can see here we have the superior angle of your scapula. Coming around, this is the manubrium and the medial margin, the inferior angle, and the lateral margin of your scapula. Here is your lateral angle. Coming around, you have your humerus, your glenohumeral joint, and the lesser tubercle with your greater tubercle with the bicipital groove right down the middle. Your coracoid process is here, your acromion with your acromioclavicular joint or your AC joint. This is a CT, it's 3D, so we'll start over here. So here's your sternal end of your left clavicle. You have your superior angle of your scapula with the scapular spine. Coming over to the end here, we have the acromial end of the clavicle with your AC joint right there, and your acromion. Here is a lateral angle of your scapula with the glenohumeral joint, and we have the glenoid process with the humerus, the lateral margin, the inferior angle, and the medial margin. We have your manubrium, and this is your right clavicle with your sternoclavicular joint. So here is a CT. CT is a lot harder to see, and I won't ask you any kind of great details with CT like I will with MRI, and you'll see the difference. So for bone work, CT is great. So here is your clavicle, your AC joint, and your acromion. Here is a CT. They keep showing pathologies within their scans on the CT, which make me laugh. This is pretty bad. This is air in the joint space, so that's really bad. So starting here, we'll start with the lesser tubercle, and I wouldn't ask you to label that. It's not clear enough. Here's the coracoid process. We have your subscapularis, your supraspinatus muscle. So this is subscapularis muscle, supraspinatus muscle. And we have your infraspinatus muscle. This is your glenoid fossa right there, which is completely degenerated. And, oh, you have your bicipital groove here, and your deltoid muscle comes around the most lateral. And your greater tubercle is there. So here's another CT. This is in lung windows, not bone windows, so you can see the bones aren't jumping out real clearly like they were on the others. So starting up top, you have your manubrium, your AC joint, and this is the sternal end of your clavicle. We have a rib right there. This is the head of your humerus with your scapula coming around. Looking here, this is your thoracic vertebral body. You have your costotransverse joint right there with your rib. Okay, this is a coronal Mri T1. So you can see your clavicle, your AC joint, and your acromion. This is your coracoid process right here. So more review here. We'll start with the scapular spine, scapular notch, your coracoid, your acromion, your glenoid process with your glenoid fossa, and your infraglenoid tubercle. So you have your infraspinous fossa here, so your muscle slides right in there. And then your supraspinous fossa, which has your supraspinous muscle. Okay, so looking here, we have your coracoid, your acromion, glenoid fossa, inferior glenoid tubercle, and your supraglenoid tubercle. This is a sagittal T1. So we have the clavicle, your supraspinatus muscle, your acromion, your infraspinatus muscle, this is your deltoid, your teres minor, your glenoid, what do they call this? Oh, just your glenoid, and your subscapularis muscle. So looking here, we have your coracoid process. I'd have you label your clavicle. This is your scapula. This is your scapular spine. and this is your joint space right there, your glenoid fossa. And of course, your humerus and your greater tubercle. Mri T1. So we look here, we have your acromion, your humeral head, and they are calling this, the greater tubercle, and this is your glenoid fossa. Your infraglenoid tubercle is down here, and this is your supraglenoid tubercle, and there's the labrum that comes right off of there. Looking at the whole humerus, we have the head of the humerus. This is the proximal end, distal end. We have the surgical neck. This is the radial groove. And the body, we have the lateral epicondyle with the medial epicondyle with the olecranon process and the trochlea. Coming over, we have the coronoid fossa with the trochlea, the capitulum, and I want you to know the supracondylar ridge. And then we have a deltoid tuberosity. Yes, that's where the deltoid attaches. When you're scanning an MRI or CT, you need to make sure you get all the way through that and see if there's any kind of tears. So we have the lesser tubercle, the greater tubercle, here's your anatomical neck, and the intertubercular groove. This is a proton density axial, so MRI axial PD. We look here, we have the lesser tubercle. Here we have the what are they calling this? Glenohumeral ligament. Yep. And the that one you can see here, the coracohumeral ligament, the coracoid, and this is your labrums right here. So you hear about people with labral tears. There's little tears there. We have the scapular spine, and this is your infraspinatus muscle, and this is your deltoid. You can see there's a little ream of fluid in there that's bright, so you can see between the two muscles nicely. This is your greater tubercle. This is your bicipital groove or your intertubercular groove. I'll take either answer. This is your lesser tubercle. Okay, so this is a T2 fat sat, coronal. So here is your acromion, your deltoid. This is your anatomical neck, your surgical neck, and your supraspinatus tendon. Tendon is here, your muscle's here. So the muscle, supraspinatus muscle, goes into your supraspinatus tendon. This is a coronal T1. So this is your trapezius muscle with your acromion, your deltoid. This is your glenoid with your subscapularis and your supraspinatus, or subscapularis. All right. Oh, we missed the sagittal. So the acromial ligament, you can see it right there with your supraspinatus tendon. We've got your acromion, your infraspinatus tendon, humeral head with your teres minor, your coracobrachialis muscle, easy to say, and this is your biceps brachial long head, and then you have your deltoid here. This gives you an idea how it kind of fits together. So if we start here with your acromion, we have your acromioclavicular ligament. So think about the two parts that are attaching. So it attaches to the acromion and the clavicle, so acromioclavicular ligament. You have your coracoacromial ligament, so the two attaching there. You have your coraclavicular ligament, so you can see the two attaching there. So you've got that attaching to the coracoid, to the acromion. You've got the acromion to the clavicle. You've got the clavicle to the coracoid. So just if you say it backwards, we'll giggle and correct you, but you've got it right, okay? So this is your coracoid process coming across, and your glenohumeral ligaments here. Let's see. Oh, your coracohumeral ligaments, so coracoid to the humerus. So looking here again, your coracohumeral ligament with your coraclavicular ligament. Here's your supraspinatus muscle, your infraspinatus muscle, your deltoid. Here's your teres minor with your teres major down lower, and you've got your coracobrachialis muscle with your subscapularis muscle here. Another sagittal. The radiologists really love these sagittal images. They're very confusing and take a while to deeply understand them, so don't be discouraged. So the coroclavicular ligament is here. Here's the clavicle. Here's the acromioclavicular ligament. We've got the acromion. So going down, we have the superior labrum is right there. We've got infraspinatus muscle, the teres minor, with the deltoid outside, with the teres major. This is your tricep muscle, and this is your coracobrachialis, and your anterior capsule of your shoulder joint is right there. This is your glenohumeral joint. This is the joint. So your subscapularis tendon is there with your coracoid process and your corohumeral ligament. You can see it nicely spread out right there. All right, so looking here, this is your supraspinatus muscle, which goes into your supraspinatus tendon. So the tendon doesn't have any fluid in it, so it's going to be dark on MRI. So here's your deltoid humeral head, and they are calling this the long head of your brachius tendon. So here's your glenoid, this is your labrum. So this is inferior and superior labrum. This here is an axial, this is your deltoid, and this is your supraspinatus muscle and your coracoid process right there. So this one's kind of tough because the way that we scanned it, the bone and the muscle look about the same. So, all right, looking here, this is your subscapularis muscle, and this should be your subscapularis tendon here where it's attaching. This is your deltoid, your labrums right here, the L's, and your glenoid. So coming over here, we have your deltoid coming out wide with your I want to ask you that one. Here's your bicep tendon. Here's I want you to know your glenoid space, so the joint, and then your labrum right there. So this one has a huge pathology. This is air in the joint. This is not normal. This is your subscapularis muscle. And this is a PD. Looking here, it's blown up for you, which is nice, but this is your lesser tubercle, greater tubercle with your bicep groove. You have your labrums here and your glenoid, and this is your subscapularis muscle right here. So greater tubercle, lesser tubercle, bicipital groove. You have, I want you to know, your coracoid, your clavicle, subscapularis muscle. Here's your supraspinatus muscle, your scapular spine, your infraspinatus muscle is here, and your glenoid fossa. Okay, so looking here where the muscles kind of lie, so we have your acromion with your AC joint, with your clavicle. This is your supraspinatus muscle, your glenoid fossa. This is your scapula, of course. And you have your labrum. This is your inferior and superior labrum. This is your biceps long head, okay, so it comes up and around and attaches. This is your deltoid, comes up and attaches to your acromion. I want you to know, that should work. We have little bursas, so little sacs of fluid in there, okay? Looking here, this is your acromion. This is the coracomial ligament. And this is your corohumeral ligament coming across here. And this is your subscapularis muscle and your deltoid muscle cut away. So levator muscle, this is your clavicle, this is your supraspinatus, your infraspinatus with your teres minor and major. We call them just teres muscle. I won't make you give me the difference unless it's on a sagittal. So here's your rhomboids, and same thing, just rhomboids. Coming across, you have your latissimus dorsi, your deltoid, your trapezius. This scan is an axial, it's a PD, so MRI axial PD. And what we do is this is a key scan. So this is your supraspinatus muscle coming across here. Now when we actually scan, this is how we scan. So this line right here is actually the line for the coronal plane. So we will angle to this line. So when we scan our sagittals, we are scanning to this line. So we're going to go based off of our coronals. This is a true coronal for the shoulder, and this is a true sagittal for the shoulder. So if you see the MRI text angling really funny, it's because we're angling to the supraspinatus muscle. So this muscle is very important. It's usually an axial. PD is the first scan we do so that we can find the true plane of the shoulder. So supraspinatus muscle, you have your infraspinatus muscle coming in right there. This is your scapular spine and your deltoid out around laterally. So greater tubercle coracohumeral ligament, and we have the glenoid process with the coracoid and your scapular spine, infraspinatus muscle, and I want you to know your deltoid over here, your biceps tendon coming in, and what I want you to know, subscapularis tendon is right here with your anterior and posterior labrum. This is your glenoid and your infraspinatus muscle. So your biceps tendon, lesser tubercle, and this is your biceps tendon short head actually, and we have your subscapularis muscle, your teres minor, so we're down lower, and your deltoid. Your brachial plexus, clavicle, remember your scalene muscles. I want you to know your deltoid, your supraspinatus muscle coming across here. Your infraspinatus is coming in right there. And your trapezius is around back. This is your scapula. So brachial plexus, you have your clavicle. I want you to know your coracoid, your deltoid muscle, your humeral head. Supraspinatus is hard to tell on this one. It's actually coming across here. This is your scapular spine and your scapula. So don't let this throw you. See the double bones? The double bones is still your scapula, okay? So this is the actual scapula and this is your spine. Looking here, this is your subscapularis muscle. I like the deltoid. Your infraspinatus is here with your scapula coming around. And so clavicle, I like your scalene muscles right here with your supraspinatus muscle. So here you go again. Here's your scapula with your scapular spine. So it lies right in between the two. So pectoralis major, and you can see your pectoralis minor right there, and you got your deltoid coming around back, your humeral head. This is your subscapularis. This is your scapula, and that's pretty good. So this is really good in showing the pectoralis major and the pectoralis minor. We have lymph nodes. They're suspended in fat. So if you see this black on CT, that's fat. And here's your lymph nodes. So here's your teres major, your deltoid muscle coming around back, your infraspinatus, so you know you're down low, but you can tell because you're in lung. So you have your scapula right here. And in between the ribs, remember that, is the intercostal muscle. So this is posterior, and this is a coronal cut. So this is your clavicle across here. This is your infraspinatus muscle, your teres minor. Here's your brachial plexus and your deltoid coming down. This is a little bit more anterior. You can see the trapezius with this supraspinatus, and you have your superior glenoid labrum, your glenoid process, your subscapularis muscles here, coracobrachialis muscles right here. I want you to know your humerus, here's your deltoid, and your clavicle. So looking here, this is coronal, this is more anterior. So we have the coracoid process with your clavicle. The supraspinatus muscle comes right through here. Here's your trapezius. This is your subscapularis muscle. And this is your corahumeral ligament. So you can see the coracoid and the humerus. So that's the corahumeral. We have the brachial, the biceps tendon and your deltoid. So this one is even more anterior. So we're looking at the corahumeral ligament coming across, but this is the coracoid, the clavicle, so the acromial ligament coming across right here is a great shot of it. We have the subscapularis muscle, and the deltoid is what you see well. Here is a sagittal, and you can see your corohumeral ligament coming across with your acromioclavicular ligament coming across. Supraspinatus tendon is there, and here's your AC joint with your supraspinatus muscle. Your acromion infraspinatus tendon is right there with your infraspinatus muscle. We have the teres minor with the teres major down below it. Here's your deltoid around back. The deltoid goes kind of all the way around, and the cut that we have here. This is your corobrachialis muscle with your subscapularis muscle and your coracoid process with your deltoid. So this one is coming, it's more medial, and we're looking, you can see your corohumeral ligament with your subscapularis tendon, and we have your superior labrum right here, and your acromioclavicular ligament coming across right there. And supraspinatus muscle, infraspinatus muscle, here's your deltoid, here's your teres minor, teres major, triceps, corobrachialis muscle, and here's your deltoid on the other side. So looking here, this is the spine of the scapula, and here's your clavicle. This is your deltoid muscle, and you can see where it comes down to the deltoid tuberosity. So when you're scanning, you need to make sure that you cover that completely. Looking here, we have your infraspinatus muscle with your teres minor and, oh, your teres major, sorry. This is your teres major. Supraspinatus muscle, and here's your teres minor. And looking here, this is your subscapularis muscle. You can see where it attaches in the groove there. This is a good way to look at it. We have the pectoralis minor, pectoralis major. We have, what do we have? Corobrachialis, and this is your deltoid coming around. So here's the tendon of your biceps brachii, your greater tubercle. Here's the head of your humerus. This is your glenoid fossa. Your deltoid, like I said, this right here is your infraspinatus and your scapula and your subscapularis. Wee-wee, huh? So looking, this is your serratus anterior muscles, and we have back here, these are your pectoral, oh, this is anterior pectoralis major, and your minor down underneath. Okay, so that's it for the shoulder. That's it, right? So we'll cover the humerus to the elbow in the next PowerPoint.